I'm Dr. Ange Mack. Welcome to In Your Home from Around the World. Today we have with us Dr. Christopher Leet, who will be walking us through a 10-minute guided meditation. And this is something that he's not new to. He's been doing it for many, many years. Dr. Leet, thank you so much for being on my little At Home from Around the World series that we're doing right now.
Certainly.
And you are a medical doctor, and I know you're a cardiologist because we interviewed before. How did you get into meditation, and why do you think this is important right now?
Well, it's an interesting story. About 20 years ago, I had a heart attack, and after that, I had an episode of depression. Really, it was a PTSD, and they tried to prescribe a lot of antidepressant medications for me, and I really didn't want to take those very much. So actually, my wife suggested that I try something like meditation, which I'd never done before.
Okay.
And so I went around to a lot of different places and learned what meditation was all about. And I was able to do enough of it that I actually got myself off all of the medications and got over the PTSD, and I've been fine ever since. It's been over 20 years now.
That's an incredible story, especially coming from a cardiologist, a traditionally trained cardiologist, and knowing what you went through, and just you yourself realizing, okay, there could be something else I could be doing for myself. You didn't want to be on all the pharmaceuticals that you were on, and taking those steps to basically heal yourself.
Right.
As you know, it has like a wide range of application, meditation does. And I know meditation, like sitting still and, trying to quiet your mind, is not for everyone. Tell us a little bit about the different types of meditation and what you practice and provide.
Well, I'll just tell you, after I did all of this, I went back to work, and my office staff said that my personality had changed a lot, that instead of being very, very aggressive, they said I was a pussycat now.
Wow.
So, but anyway, there's a lot of different types of meditation. There's at least, well, I know of 7 or 8 myself. There's 3 of them that are most common. The most common one is called mindful meditation. And that's the sort of thing where you are learning how to just focus on yourself in the moment and be alive and aware of everything that's going on around you, but not depressed or not sidetracked by other thoughts or anything like that.
Right.
There's another type that's also popular. It's called transcendental meditation. And in that, there's a mantra that you learn to repeat in a certain way, and that gets your mind calmed too. Then there's also what's called guided imagery, where somebody takes you to a place where you feel very comfortable and relaxed, and go through a series of exercises that way. And there's a number of other types of meditation, but those are the most popular ones right now.
Well, I'm hoping you can take me to a place like the Sherwood Forest where I can relax and just kind of hang out and clear my mind of things. Hopefully none of the merry men will be prancing around while we're here doing this. But what specific type will you be doing with me today and for our viewers?
Well, today I was going to do mindful meditation,
Okay.
just because that's the main one that I learned and that did the most for me. And I think once you learn this sort of thing, and it is something that you have to practice,
Sure.
but once I learned this, it changed a lot of things. I don't get upset about anything anymore. And
That's a
so
great
I'm
skill. That is a great
very calm.
Mm-hmm.
So.
Well, these days, as we know, there's a lot of anxiety and fear and uncertainty with the coronavirus going around, and people's minds just might be going a mile a minute. And one of the things I know with meditation is it's really good to help quiet the chatter and focus on something else, and just give yourself, your mind, your body, your spirit a chance to deep breathe and relax and stop all that and clear all that. And it's something, once you learn it, you can keep going back to that when you feel so much on edge, or you can't really make any decisions because you feel overwhelmed. Do you think that what you're going to show me today is going to be like a 10-minute version of what you do? Do you think you'll be able to, help people quiet their minds and get to that peaceful place?
Yes, well, you can do it as long as you want. I'll try to do something in 10 minutes, but the main thing is you need to practice this. I mean, you can't do it one day and expect everything to be better. And in fact, I frequently advise people to combine this with yoga,
Yeah.
and because the two practices are complementary. And but it's something where you need to do it every day, at least for a while, till you get used to it. Do it at a time where your mind is alert. Um, this mindful meditation, if you're doing it while you're sleepy, it'll put you to sleep. And that's not the idea. The idea is to have your mind alert so that you can train your mind to control the various functions of your body.
Yeah, and that's a
And
great point,
then,
because
yeah,
sometimes I will try to meditate at night to go to sleep. So, but what we're doing here is just trying to get ourselves to a baseline calmness and peace of mind so we can go forward with our day.
right. This is not really meant to be used as a sleeping adjunct. It's meant to be used to keep your mind alert and to keep you in the moment and not be distracted by all of the other things that are going on in your life.
Perfect, perfect. So, Dr. Lee, I know you have a meditation CD that you provide
Yes.
as well, and I will say that it's your methods of relaxation and driving or providing the meditation series with along with your very soothing voice is just a perfect combination for what I think a lot of people could use right now. How would someone get in touch with you if they wanted a CD?
Yes, I so far have sold about 600 of these, but you can go to my email, which is Leet, that's Leet, at Erols, that's EROLS.com, and I'll get right back to you. The CDs are $15, and that includes mailing it to you. So,
Perfect.
and I've got about 70 of them that are still left.
Yes, and we're
So,
going to figure out how to get these through SoundCloud and recorded so people can stream them as well here, hopefully in the very near future. I think I can help you get this going so people all over the world can have access to what you provide. Such a healing art that this is. One of the things I like to do is get super comfortable, which I am here, just in a very comfy shirt, comfy clothes, and just like sitting here in the middle of the forest with my back up against, a pine tree here. It's like the perfect environment for me. I probably won't hear any sounds except for possibly a lawnmower or a weed whacker. But other than that, the environment hopefully will be very calm, and you'll be able to walk me through. So with that, what would you like me to do next? So I'll get comfortable.
well, um, what I usually tell everybody is to find a nice, quiet, comfortable place in the house where nobody's going to bother you for 15, 20 minutes, whatever. Although we won't take that long today. Um, and someplace that you're very comfortable with. Preferably do it about the same time every day. I used to do it when I first got up in the morning, and because my mind was alert. So, but why don't you just sit back and relax Now, take some deep breaths through your nose.
Should I close my eyes?
You don't have to, but it's probably better. Take some deep breaths in and out through your nose a couple of times here. And then what we're going to do is a series of relaxation exercises. So at first, I want you to tighten all the muscles in your scalp, your forehead. Hold that for a second and then let it go. Next, we'll move down to your jaw. Just clench your teeth for a second.
I will say, I'm going to interject maybe a little bit here as we're doing this too. Like with the jaw, people that have TMJ or clench or grind their teeth at night, this is really good because it kind of gets you aware of how much tension you might be holding, in your jaw. So like what
this is just a guidance. You don't have to do everything exactly the way I say.
No, it's great. It's great. So clench your muscles.
All right. But then let's go to your neck and tighten up. Yes. Shrug your shoulders. Hold it real tight for a second and then let it go.
That's my tight area.
Now put your hands on your knees and just tighten the muscles in your arms. And then let them go. And then your hands, squeeze your hands tight together.
Should I be breathing in and out with this?
Yes, you keep breathing in and out through your nose. And let the hands go. Then we go to the chest. And we're going to take some deep breaths in and out through your nose. And then we go down to your stomach and just tighten the muscles in your abdomen real tight. And then let them go. And then we go down to your hips. Just tighten the muscles in your hips. And let them go. And then to your thighs. Tighten your thighs and hold it. And let it go. Still keep doing nice deep breaths. And go down to your calves. Tighten the calves and hold it for a few seconds. And let them go. Now all of the muscles in your body should be stretched and relaxed. And you just keep taking nice deep breaths through your nose. And if you find that the world is still getting to you and you're having a lot of thoughts, just create a shelf in the back of your mind and put those thoughts up on the shelf. Just tell yourself, I don't need to think about them now. I'll think about them later. And then just continue your breathing in and out through your nose. And now you can keep that going for as long as you would like.
What do you do when the thoughts come back? Do you focus on anything? Your breath?
Just
Or...
just put them back on the shelf. This won't work for everybody right away. You have to, this is why you need to practice. To put the thoughts back in the back of your head and just tell yourself you'll think about them later. And just concentrate on the air going in and out of your nose. And as I say, you can do this for as long as you want, and you'll find everything relaxing.
You know what?
So when you come out of this, then don't just wake up right away. Just gradually relax your muscles, and then come back to the present. And that's it. And you can do this, as I say, as little or as long as you want, but you need to do it on a repetitive basis so that this becomes ingrained in you. And I think that if you keep doing this, and particularly tie it in with some yoga, as I say, I used to do in the morning when I got up 15 minutes of meditation and 15 minutes of yoga. And by the time I was ready to go to work, everything was cool.
Yeah, everything was flowing and calm, and your blood was flowing,
yeah.
your mind was calm. So I can.
Yeah.
I mean, I know there's huge benefits. I have a challenging time just not focusing on anything because my mind is always usually going a mile a minute. Sometimes if I focus just on feeling the air kind of going through my nose and out of my nose, like into my body and out of my body, just bringing back my focus just to that process, it can kind of help my mind from going.
That's the idea. But that's why you need to practice, because it's not easy to do this on the first shot. You need to do it like every day, about the same time every day. And I think that if you do this, you'll notice probably after about the first week that something's changing. And the thing that's changing is that things are just not bothering you as much anymore. And once that dawns on you, then you'll realize what this is doing to your whole system. And it's well known that this can help people with blood pressure problems and a lot of other things. It'll just put them in a mentally better position.
And with you, PTSD.
I found that it was also, I'm sorry?
I said you had symptoms of PTSD. So what were some of your symptoms and how did the meditation diminish those?
Well, at first I started out having strange dreams at night, and not horrible dreams, but the sort of dream that just was repetitive all night long. Something where you had a problem that you just couldn't resolve and it just kept going and going and going. I think everybody has those from time to time, but after I had them every night for about 10 days, it dawned on me, hey, this is depression. And when I woke up in the morning, I didn't want to go to work, and I wasn't well rested. And after I learned this for a while, all of a sudden, that didn't come back anymore. And, so I've felt in using this with patients, there are sometimes the patients need medication along with the meditation to start with. But once they get used to the meditation and how to change their mode of thinking, a lot of times they can get off the medication completely. And that's
Right.
a good feeling.
I think that's like the best piece. And I understand people are on medication for some of the depressions and the anxieties and things like that. And if you are and you do meditation and you feel like it's starting to help, then work with your doctor. Don't just get off your medications. Work with your doctor, titrate off as he or she prescribes, and hopefully this could be, like you were saying, Dr. Lee, a great adjunct to helping calm your mind and getting you off maybe some of these pharmaceuticals that can wreck our systems after a while, because our systems forget how to balance on its own when we inundate it with too many things that chemically can, just kind of adjust things and throw things off. Some of us really, really need that support, but when you don't,
Yes.
like yourself, it can be just a world changing feeling.
And I even found during the day when I was working that if the stresses of the job got to you, I could very often take 5 minutes, go back to my office and close the door and just do some of the breathing exercises like that and
Right.
relax the muscles and in 5 minutes you were feeling better. But the advantage to that is that you can do it as often as you want or as
Well,
often as you need.
so you're a doctor. So when you were at, working, full time as a doctor and prescribing and such, did you ever just like prescribe meditation? You saw people like were uptight walking down the street. You just like rip off a prescription and say, hey, you need to go, meditate. I'm prescribing you 10 minutes of meditation, 20 minutes of meditation day. Did you like take that authority upon yourself, or would you not make friends very easily if you did something like that?
No, I did it mostly to my patients in the office. And once I produced the CDs, and I sold quite a few of those, and I got generally good feedback. There were a few people that thought this was a little crazy, but the ones who really tried it and stuck with it um, really benefited by it.
Absolutely. Absolutely. Well, Dr. Lee, thank you so much for being on our little program today and sharing what you do so well with all of us. If someone doesn't remember the email, lead@arrows.net,
No, .com.
lead@arrows.com. I'll also have it on my Dr. Ange Mack blog spot, and it'll be on this YouTube caption too. So you'll be able to, find Dr. Leet, and hopefully we can get this downloaded into some kind of a podcast form or a SoundCloud form, and have more of Dr. Leet going forward. Thank you for joining me, Dr. Leet. Thank you for working with us to help us during this time and just make us all feel better, mind, body, and spirit.
Yeah, I was happy to do it.
Until next time, stay well, take care, breathe deep, and look after one another.
And learn how to put the thoughts in the back of your head.
What he said. Take care.